Are you suffering from one-sided weakness with aches and pain on your hips, back, and neck? Hi, my name is Annie. Welcome back to my channel, and this is episode 6, video 6 of my core back protocol. If you missed my first 5 videos, make sure you look back at it. I have a lot of amazing slow progression, and this video is a massive thank you to each one of you who've been following along my free 6-part video series. And you want to make sure you don't miss out. Learn about the root of your problem. Video 1 is where I discuss that. Video 2 is where we learn about dead butt syndrome, how to wake up your buttocks if it's been weak and deconditioned from sitting too much. Video 3 is the key secrets of my 20 years as a physical therapist, Pilates and yoga instructor on how to learn the core back protocol and find out how to comprehensively improve the core endurance and stamina. Video 4 is where I gave my entire blueprint of my comprehensive core back protocol, where I use the wall Pilates, the ball, the foam roller, improve your postural awareness. And video 5 is where we did some self-myofascial release, nerve flossing, and learn about my amazing student Suzanne, who graduated recently from my back masterclass from Ireland. And she felt so much relief in a short span of 2 weeks. Less than 2 weeks, she felt so much better in her hips and no more neck pain from her accident whiplash injury. So we want to make sure you watch all those videos. Do it every single day, 1 video a day until you reach this video 6, or as I gonna try to apply everything we learned. Still beginner program. And today I have my lovely friend Sandy, who's a beginner, and she has postpartum weakness. And her baby is only 2 years old, 2.5. And she has 4 babies. And today she found out one-sided weakness on her right side. So this video is for her. So she can do this every day to balance the muscle imbalance she has. She is right-handed, but her right side is weaker than her left. And she was pleasantly surprised how come she's weaker. And she didn't realize it until we did this assessment on doing isometric, which means resisting against your hand or any tools without moving the body. And she's so unstable on her right side. Right, Sandy? And today, this is going to be her homework. I told her we're going to do this daily reminders for her to connect to that muscle imbalance. That's why I have the core back protocol, where I slowly build up from beginner, proper breathing, breath work, core engagement, because since she had 4 babies and she had this muscle imbalance, it's very difficult for her to feel her core muscles to be stronger again, right? She felt her abs are weak and deeper core is not engaging. And that's why I have this lovely program. We're going to follow along. We're going to need some ball, because a ball will give you stability, at the same time challenge. We're going to need some elastic bands. And if you don't have elastic bands, you can still use dumbbells. But the difference between the two about elastic bands and dumbbells, the elastic band gives you that different kinds of resistance once you let go. So first, we're going to do proper alignment. For me, my weaker side is my left side. So for Sandy, she's going to do the right side. So if you have to find out the root of your problem. So go back to video 1, do your self-assessment tool. Which one is your tilt? Once you found out which one is the lower area and the weaker side, usually that's where you have that give. And you want to lift that area and then lower the elevated opposite side. So I'm going to open this elastic band for our program today. And you're going to need a foam roller. And if you don't have a foam roller, you can use a rolled towel up to 6 inches diameter. For absolute beginners, rolled towel is fine. So it's not too firm. And this is my own foam roller that I'm going to launch very soon. Okay, let's lie on your back. Use the ball as a support for your weak abdominal muscles, your core, your hip flexors. And for Sandy, as I said, it's her right side. She's going to do some resistance. Mine is the left. And I want you to start taking a deep breath through your nose. Expand your rib cage, your abdominal muscles rising, and then zip it up from your lower abs to your navel, and gently press both hands against the top of your leg, your thigh, and your knee, and breathe out. So Sandy's doing her right, I'm doing my left. For at least 10 seconds, hold. And my recommendation is 10 repetitions. And then slowly lower your foot down. As you breathe in again, breathe out, press. And you're gonna keep that other ball stable by pressing your right foot down. So Sandy's pressing down with her left leg, her left foot to stabilize. And then relax, lower your foot down, take a deep breath, and then press against your thigh and breathe out. Breathe in, breathe out. And then relax, inhale, exhale, and press. How are you feeling, Sandy? Good. Getting fatigue on your right hip? Can you feel it now? Yes. And that's when you know it's really working hard, and she might feel fatigue all the way to her thigh, right? And then relax. Now, once you start lifting that weaker side, mine is left, Sandy's right, I'm gonna interlock my fingers and I'm gonna place my hands behind my other leg, my other thigh. So she's pressing it against her hands. So I'm trying to extend my leg, keeping it to 90-degree bent, and I'm resisting behind my thigh. As I take a deep breath, breathe out. Inhale, exhale. Breathe in and breathe out, relax. And we'll do a few more repetitions. And my recommendation is also 10 repetitions. So what we're doing, as we extend lower, we are lowering that side. For her is the left side, which is her stronger side. And this will help the lateral tilt as you breathe in and breathe out. And relax. Inhale. Interlock your fingers and press. We're going to do one more repetition. This is a sample. But inside my Back Masterclass 8-week course, I have a lot of daily small increment videos, great for beginners who are in pain. Slow progressive, as you've heard Suzanne from Ireland. Watch that video where she described it as very detailed, to the point that her therapy that she's paying in Ireland and Pilates doesn't cover. So this is very comprehensive, guys. Beautiful. So now we're gonna glue them together by placing your hands outside of your knees. And you're gonna press against it. As you take a deep breath and press against it, and you're trying to open your knees out while you're against your hands. So you're gonna feel a little bit shakiness. You feel that on your hips? There you go. And hold that for 10 seconds, hold, and relax. And my recommendation is 10 repetitions as well. I would also like to thank each and every one of you who've been emailing me, or sending me inboxes on my Instagram and YouTube, and I apologize if I haven't replied. I received thousands of emails and daily inquiries, and if I haven't replied, I apologize. And that's why I made this video, to answer most of your questions, because my 8-week course has some equipment. You will need a ball, elastic band, foam rollers, and a wall. So press against it, breathe in and breathe out. Last set, inhale, exhale, press against it. And it also has my weekly Zoom meeting calls, so I could hold you hand by hand to reach and guide you safely and effectively. Well done. You feel tired on your arms too, right? So you're resisting, so you're improving strength, and now you make a fist. Both hands, place it between your thighs, between your knees. There you go. And then you're gonna squeeze your fisted hands and squeeze as much as you can without hurting your hands. And resist that for 10 seconds, hold. So we're activating your hip adductors, and this will help glue them together. Breathe in again. Make sure you incorporate your breath work and squeeze your fisted hands, and breathe out. Breathe in and breathe out. Last set, inhale and exhale. My recommendation is to do that 10 reps as well. So now we're going to extend your legs. We're going to glue them further by doing some hip thrusts, placing your hands on your side. As you breathe in, breathe out, lift. Squeeze your core in. Inhale. Exhale, squeeze your core in and slowly roll down, bone to bone, down to the mat, and breathe out. Breathe in, breathe out, lift. Squeeze your buttocks as hard as you can. Squeeze your abdominal muscles as well. Zip it up from your lower abs to your navel. And hold that for 10 seconds, hold. And take a deep breath again. And breathe out, slowly lower your hip back, bone to bone, gently as you go all the way down to the mat. The slow, controlled movement patterns are so important. Lift again to incorporate mind-body connection and really activate your postural muscles. Squeeze, holding is so important, the isometric, to build stability on your unstable back and core. And breathe out so you feel connected again. You feel that connection, right, Sandy? It's different from doing ab workout, right? Isn't that beautiful? Take a deep breath. Breathe out, squeeze your core in. So those breath works, don't neglect them. They're very critical for the improvement of your core muscles. And breathe out. And slowly roll down, bone to the mat. Well done. How are you feeling, Sandy? Good. It's beautiful, right? And it's still not aggressive for your spine, right? Take a deep breath and we're gonna lift one leg up, lock your knee as much as you can. And this is where we're gonna progress our isometric. For her is her right side. Mine, remember, my weaker side is my left. For those who've been following me, I've been sharing my journey of my car accident and my postpartum journey where I fractured my chest. And that's why I always have this one weaker side. And since I've been doing this, I still incorporate this in my daily life to balance the muscle imbalance that happens with injury. But because I've been doing this, I've been so active, stronger, no more pain. And that's where I could help you reach your goals. And press against your thigh. You feel that fatigue, right? As we progress, do that 10 repetitions as well on your weaker side and breathe out. Squeeze, squeeze, gently push, keep your knees locked, engage, and down. And after doing that 10 repetitions, my side is my right side. I'm going to interlock my fingers again, and Sandy's going to do the left or opposite. And I'm going to resist against my interlock hands. I'm going against it, and I'm keeping that knee lock and breathe out. Do you feel that, Sandy, the stretch? Just like contract, relax, and then down. Toes pointing to the heavens as you breathe in. And then breathe out, press against your interlock hands, against your posterior thigh, behind your thigh, and resist. Is it a little bit achy? It's a good stretch, right? It's a good way to balance her body, especially if she does heavy lifting, doing deadlifts and squats. And doing this, she was so shocked that one side is weaker, right, Sandy? Because she lifts heavy, but doesn't mean it's connected. That's the concern. When you're not connected, your abdominal muscles feel not connected. It feels wobbly. So once you connect, guess what? It will come alive. It's not too late. It's not about age. It's not about having babies. But of course, those really affected our core, right? But it's not too late to rebuild it. And that's why I'm here to guide each and every one of you. Well done. After doing that, as I've said in my videos, right? In my video too, we're going to activate our dead butt syndrome. And we're progressing now using a ball. And you can place an elastic band around your thighs to progress. So Sandy, I gave you that banded elastic band. So it's nice to have different variations of bands. Some are banded, some are longer. But you can also use dumbbells. If you don't have dumbbells for the upper body, so Sandy's going to use the elastic band, the blue band, for her upper body. So you can do different variations. You can use dumbbells on your hands or elastic band as well. And if you don't have dumbbells, you can use bottled waters for absolute beginners. All fours position, hands level to your shoulders, knees level to your hips. And we're going to slowly, in my program inside my back masterclass, you'll see some quadruped position. This helps decompress your spine. The ball will give you stability. And this is one of my key secrets inside my back masterclass program that I shared last time. So you're going to extend one leg with your knee lock. So she'll start with her right leg and lift your leg up. So if you see Sandy, that's good. Her posture is correct. Her stable is very stable. You feel that on your back, right? And breathe out through your mouth. Don't forget your breath work. And then you alternate the other side. And when you lift the opposite side, even though she's stronger on her left, she might feel unstable. You know why? Her right side is much weaker to stabilize. You feel that? It's a little bit harder for her to lift the left leg, because the right side weakness. For me, lower your foot down now, Sandy. As I lift my right, because my left hip is weaker, I feel more unstable. It's the isometric we're building as you lift your leg. So we'll do that 10 times each leg. As you breathe in and breathe out. Feels good on the hips, right? And you make sure there's no pain going down your leg. You're centralizing the pain across your hips if you have SI joint dysfunction and low back pain. Breathe in and breathe out, alternating left and right. Keep your back straight. Try to keep everything center. Try not to lean on one side too much. Core engage as you breathe out, zip it up. Inhale, exhale. And now we are progressing by incorporating our upper body. So this is getting harder, okay, my friends? Extend one arm. So she could extend with her left arm with the band. And then she kicks with the right. So she might feel unstable. You feel that, Sandy? It feels good to challenge, right? When you decrease the stability, and that's challenges, and then switch to the other side. Right arm, left leg, and breathe out. And my recommendation is do this 10 repetitions as well. So I'm gonna try to combine everything we learned this past 6-part video series. And that's why I have this 6th video, the final video, to talk about my back masterclass, my 8-week course that you can start incorporating right now. If you decide to join my program, I'm going to hold your hand to reach your goals of your back pain, hip pain, core weakness if you're postpartum, recently or many years ago, or even if you're a man, got injured. This is for male and female, it's not just for women. And sometimes men will need this because they don't do stretching or a different kind of strengthening program. They just love lifting heavy weights without doing this gentle program. Do you see the difference between heavy weights and this? Even though it's not heavy lifting, you feel it, right, Sandy? Because she lifts heavy weights and she didn't realize one side is weaker. The next one is fire hydrant or peeing like a dog. So Sandy, you're going to lift your knee and foot on the side like peeing like a dog, keeping your spine in neutral position, which means you're not really tilting so much on one side. So to keep that stable, both hands on the mat and lift. And then switch to the other side, alternating left and right, great for beginners when you alternate, so it's not too much pressure on your spine. Breathe in and breathe out. She's a little bit twisting on her spine, so I'd rather have it lower. Most of my patients with weakness, I don't want them to go all the way up and they're leaning. I'd rather have it lower on the side while keeping their spine in neutral. So I'm gonna let Sandy know when to stop. Stop, that's it. Anything more than that, she's twisting her spine because of that weakness on her gluteal muscles. Well done. So that's one of the program inside my back masterclass. And we're gonna do some lovely flossing of our nerves. So we're gonna lie on your back. We're gonna floss a little bit, remove the elastic bands. So flossing is a great way for nerve pain. So when you have pain going down your leg, when you floss your nerve, it helps decrease the inflammation on the nerve root where the nerves comes out on your lumbar spine. So interlock your fingers, toes pointing away, bend your knee to your chest. As you breathe in, breathe out, extend. And once you reach up, Sandy, you dorsiflex. That's when you floss. Do you feel that stretch? And that's not just your muscles and your ligaments and tendons. You're also stretching the nerve root, the sciatic nerve. And then slowly bend your knee while keeping your toes pointing towards you. And then once you fully flex your knee, keep your toes again, toes pointing away. Inhale, exhale, extend, dorsiflex, and then down. So you feel that beautiful gliding, right, on your back. Breathe in, breathe out. Feels good, right, Sandy? So this is a great way to cool down after heavy lifting. Isn't that beautiful? It helps reconnect to your body. Now switch to the other side. So my recommendation is just do 10 reps of this beautiful nerve floss. And there's more variations inside my back masterclass where we are going to floss our upper body if you have neck pain and your lower body. So that's one of the highlight of my nerve flossing. Now we're gonna do some postural awareness using the foam roller in vertical position. So Sandy, we're gonna keep it this way. You're gonna sit on the foam roller and slowly roll down, all the way down. Grab your elastic band, and you can use the dumbbells as well if you don't have elastic band. And then I'm gonna remove this gently. Let me remove this gently. Sorry, this is really hard to open again. Once you, there you go. Why didn't I do that earlier? I snapped it, right? Okay, sometimes I'm very silly, right, Sandy? There you go. We have it open now. And now, with your hands pointing to the heavens, making sure you're not having neck pain and upper back pain. You want to engage your shoulder muscles in your scapular. As you breathe in, breathe out, open shoulder horizontal abduction, squeeze your upper back and pull back. And feel that beautiful stretch. Do you like that stretch, Sandy? Especially if you're breastfeeding still or carrying your babies or looking down on your phone, this helps open that chest muscles. As you breathe in, back to the center and breathe out. We're going to learn about PNF patterns or postural proprioceptive neuromuscular facilitation, and this is one of my modules inside my back master class. As you breathe in and breathe out, open. So we're going to do different variations of patterns. So the patterns is the strongest movement patterns that we're going to learn together. From this position, we're going to do diagonal movement, right arm up, left arm down to your hips as you breathe out. So this helps the movement patterns of doing self-care, activities of daily living. So switch left and right. I'm trying to incorporate everything, the science-backed, evidence-based science about my program in this short few minutes of my video 6 of my core back protocol that I curated, implemented to all of my patients through years of experience. Breathe in, breathe out. Do you like that, Sandy? It feels so good, right? Inhale, exhale. There's more variations of our PNF patterns inside my back masterclass. And we'll also do some lower body that is hard to incorporate right now. So after doing that beautiful postural release, now we're going to place the foam roller on our pelvis. So why do we do gravity-assisted foam rolling? It's great for those with weak pelvic floor and weak hips. But if you're having SI joint dysfunction, stop. I'd rather start building stability. But for those who can tolerate it now, you can start doing this, making sure there's no increasing pain. Put some heat on your back before you lie down on it. How are you feeling, my dear? Feels good, right? So with this position, we're going to start incorporating some breath work. And inhale, expand your belly, zip it up and breathe out. And you squeeze your core in. Inhale, exhale, zip it up. Now we're going to slowly lift your heels up and down. Just slowly build the stability without lifting your hips, just your heels. Feel that across your hips. Oh, don't move your hips, keeping your hips up, your heels up and your hips down. There you go. Making sure you're holding on the foam roller, you're not moving your hips. So we're just slowly giving that challenge for that hip stability. Now we're going to slowly march to tabletop as you breathe out. Toes pointing away as you inhale, exhale down. Squeeze your core in as you lift. You feel that on your hips? Feels good, right? Just gently eccentric control of your hip flexors as you breathe out. Inhale as you go down, exhale as you go up. And my recommendation as well is 10 repetitions. Feels so good, right, Sandy? Feel that hip opening. And we are progressing now after 10 repetitions to lengthen your hamstrings as you breathe in. Breathe out, extend. And if you can't lock your knee, that's fine. We're going to slowly lengthen. Consistency is key to see lengthening of the muscles. Just to share you my story, actually, I was so tight on my hamstrings before, Sandy. I can't even, you're actually better. That's how tight I was. When I was 20-something years old, when I got certified, I can't even lock my knee. Just to tell you a true story, this is not genetics, it's actually hard work. So just to encourage Sandy, if she can't lock her knee yet, that's fine. Through repetitions, that's why this video is for you, Sandy. This will start lengthening someday. And this will help the instability of your hips. That's why it's not connected. It makes sense now, right, Sandy? When you're tight on your hamstring, it pulls your hips down. It makes sense, right? But some days, this will slowly lengthen. We're connecting our mind-body awareness. Your nervous system is slowly relaxing. It means it's always guarded right now. Makes sense, right? Lock your knee. And now we're going to do circle, like a size of a small dish. And lock your knee. This will help lock. So I have something more inside my back masterclass. And if you can't tolerate with the foam roller, guess what? You can do this flat. It's actually harder without the foam roller. Do you know that? The foam roller makes it easier. Do you notice that? Because when you're in the foam roller, it helps elevate. Do you notice it? Later, I'll show it to you, Sandy, without the foam roller. And then reverse circle and breathe out. And then let's switch to the other side. This helps lengthen with the foam roller and help you elevate the deconditioning of weakness. See, she's just rocking a little bit harder on her hip. I'd rather have it slow, controlled movement. There you go. See the difference? It's actually harder. When you slow down, Sandy, you're connecting more as you breathe in and breathe out. So I'm teaching her, and that's why I have my weekly Zoom calls. So I could guide you safely and effectively if you're doing correctly with that program. And then reverse circles. Breathe in and breathe out. Feels so good, right? So just to show Sandy how harder without the foam roller is, so remove the foam roller. And if she can do the same way how she did it, just to show you, with her hips down, just your leg up and lock. See how it's not as high? And she makes circles. It's much more work on her core. So that's why I have the foam roller technique, is to help you be consistent and much more pleasurable to do it, right? And see, her toes are going in. I want the toes pointing to the heavens. Lock her knee. I'd rather it lock and lower it down and circle. And this is how you can do it without the foam roller. See, big difference, right? And then reverse circle. Beautiful, with your breath work. And then switch to the other side. Inhale and exhale. And that's one of my key secrets of my comprehensive guide inside my back masterclass, where I cultivated my core back protocol. Now we're going to wrap around the elastic band again around your thighs, since she has the banded one. We're going to do some clamshell. So for Sandy, it's actually her right hip. She's just going to lie on her left. For me, it's my left side, so I'm going to go to the other side. So we're opposite of our problem. Mine is my left. I want to incorporate. You can do both sides of your hips, but my recommendation is to do an extra set on your weaker side. So Sandy, do 10 reps both sides as your homework for the clamshell. But my recommendation is to do another set on your right to improve the strength on your right hip. So with your feet together, you're going to lift the top knee without twisting your spine. So I want you to lean forward gently, Sandy, and core and breathe out. This will help the hip alignment and also really strengthen your smaller gluteal muscles at the same time, your external rotators of your hips. So gluteus medius and minimus, the smaller out of the three, and hip external rotators. I know there's a lot of anatomy I'm sharing, but I'm going to try to make it easier for you to understand. This will help the tilt of your pelvis. So this is my weaker side, my left side. And my recommendation is to hold it for 5 seconds, hold, then slowly build up to 10 until you can do that 10 reps. See, the longer you hold, right, Sandy, the more you feel the burn, right, on your hips, right? And you can tap your hips as well to wake up those muscles that need some waking up. So you can tap that to slowly give that proprioceptive feedback, biofeedback on your muscles as you breathe in and breathe out. And after doing that simple clamshell, you place it around your ankles, and we'll do reverse clamp. So the internal rotation helps target the different parts of your hip joint to start strengthen deeper muscle groups. Do you feel that, Sandy? Around your ankles, right? Do you feel that burn? It's intense, right? It looks so simple, but it's really effective on building strength. And the last one, we're going to place it around your thighs, and you're going to lift your knee and foot up at the same time. This is called parallel clamp. And you'll see this every time you're inside my program, so I can guide you safely and effectively. And the last part of our program, we're going to use the wall for wall Pilates. So we're going to lie down near the wall. Now we are here on the wall. So find a wall in your home. And Sandy, she's a few inches off a little bit further away from the wall because she's very stiff. So can you come closer? We're going to cool down now with your legs up. And this is also part of my back masterclass program. I show you sitting up on the wall in video 4 and 5. In 5, we showed you sitting up like this and lying down. So now we're gonna use the foam roller to add a little bit dynamic. So grab your foam roller and we're gonna do some beautiful wall Pilates with the foam roller. As you breathe in, breathe out, bend. Hold that position to glide back and forth. Inhale, squeeze your core in, breathe out. Inhale, exhale. Now bend your knee. This will give you a little bit challenge and instability. And lift up for a hip thrust. Hold on. You feel that instability, right? And then down. If it's too challenging for you with the foam roller, you can just use your feet against the wall for beginners. So for Sandy, she's challenging today. Feels different, right, Sandy? Because your toes, your ankles will be strengthened by doing that. It's that beautiful. Breathe in and breathe out. So that's one of side my program. Let go of the foam roller. We're gonna hold the foam roller and come closer if you want to. And we're gonna do some arms overhead with the foam roller. And then we're gonna slowly open your feet out as much as you can and breathe out, reach and up overhead, and then lift your feet up back to the center and stretch. Feels a good stretch, right? So we're doing a beautiful V stretch and a little bit core engage and breathe out. Up a little bit ab core workout without straining your neck and your back. 2 more. Last one. And 1. So this is one of the samples inside my back master class where I utilize core back protocol. And there's so much I could share. This is only a snippet of it. And it's hard to condense everything. That's why I have my free 6-part video series to visualize what's inside my course. And then how do you find it, Sandy? You like it? It's refreshing, right? But it feels good after, right? And that's what I would like you to experience with my back masterclass. I'm hoping you enjoyed this free 6-part video series. If you have any questions, suggestions, concerns, leave a comment down below or direct message me on my email or my other social media. And that's why I created this last video as a thank you to each one of you, and then apologize if I haven't replied to everyone who's been DMing me, asking me questions, because there's so many of you. I'm so thankful that you guys embraced my free 6-part video series with open heart. And I enjoyed making this video series to teach and help as much people as I can around the world. If you have any questions, as I said, leave a comment. And if you have more time today, don't miss out. Video 1 is over here. Video 2 is over here. And to be part of the early bird waitlist as I reopen on September 1st, click the link over here, write your name and email address so you can get access before the public. I'll see you inside my back master class. Always remember, be safe, be well, and healthy you. Bye! Thank you, Sandy. Did you enjoy it?